And you're what?
All right, good morning. This is Senate Health and Welfare. It is Wednesday, April 16th. And we all got our taxes in yesterday. So now we're feeling the load off our shoulders or not. So the first thing we're looking at, we're looking at H218 this morning for a vote. And then we're going to move on to an interesting presentation from Soluna. We've heard from them before, the Mental Health Care Act. I'm looking forward to that. And then we'll move on to our other bills that we've been looking on. So we have H218. This was Katie's bill, the funding from the opioid settlement abatement program. And we had a introduction to the bill, both from Katie and Nolan, as well as I think we had the House member on too. So committee, I would entertain a motion so we could go move into discussion on the bill. Is there a motion on H218?
I'll make a motion to vote favorably on H218.
Yes,
Second that.
I suppose.
okay. Thank you. Okay, so discussion. Okay, hearing none. It says pass House. Senator Fleur. It's the way of looking at it.
Legally change my name, just Chair.
Okay.
All right, when calling your name, please say yes or no. Senator Hart? Yes. Senator Cummings?
Yes.
Senator Meade? No. Senator Gillen?
Yes.
Senator Alexis?
Yes. So, the bill will go to, we'll take it upstairs, then we'll go to appropriations. Senator Hart, do you want to be the person responsible for the bill, the reporter of the bill? It probably will end up in the big bill. Probably will not come out as a full bill. Do you want to?
I would prefer not to.
Okay, all right, good. I'll do it. Because then it'll be with me down the wall.
Senator Chair?
Yeah. Senator Chair. Will be.
Yeah. See, it goes both ways.
Okay. Good, thank you for that. And Kiki, I'll get a copy and run it upstairs. Okay, thank you. So we're going to move on. We have with us Dr. Laura Tully, who is here. Wow. Nick of time. Yes, please. Yeah, have a seat.
Good morning. Good morning.
Good morning. So Dr. Tully, you're here from Digital Health. Maybe you could tell us, we're going to introduce ourselves to you first, and then we'll have you introduce yourself and tell us a little about who you are, and then what we're seeing in this app. We'll start here.
Senator Larry Hart, Orange County.
Nice to meet you, Senator.
San Rose, Owens County.
Nice to meet you.
Senator Ginny Lyons, Chittenden Southeast.
Nice to meet you in person.
Martine Larocque with Chittenden Central.
Nice to meet you, Martin. And family portion. Thank you. Meet you, Madam.
Well, thank you for being here. And we have heard from folks about Soluna, but it's been intermittent and not consistent, so we need reinforcement.
That's what I'm here to provide. I'm here for any and all questions. I'll introduce myself a little bit about my background. And then I've got some information to share, both about the problem we're trying to solve together and how the platform Soluna and similar solutions like it can help us solve that problem. Does that sound like an okay pathway through? Okay. My name is Dr. Tully. I'm a clinical psychologist and cognitive neuroscientist. I am British by birth, but I have been in the States for about 20 years, which is why I sound strange. I came over here to do my PhD, which I completed at Harvard. So New England and this area is close to my heart, but I now live in California. And I am the VP of Partnerships for Tooth. And what that means is I get to have discussions with folks like yourself and other important stakeholders in the system of care to figure out how we can solve the youth mental health crisis that I think we're all very aware of. And how prevention programs like Saluna can shift our system from what I call a wait to fail. So right now, the first time we learn that a young person is in crisis is when they hit the crisis center, right? We need to move that to supporting them way before so they never come to the end. And that's what Saluna's goal is and what the model is built on. So just as to start, let's all kind of get a scope of the problem. We know that youth across the country and Vermont youth are in the midst of a mental health crisis that our current system cannot meet alone. It's not just an individual concern, it's a systemic challenge, and it requires innovative and scalable solutions beyond traditional care. We are never going to train enough providers and get them in the right places for every young person to have an in-person appointment. The American Psychological Association has run those models. We need additional solutions. What we know in Vermont is that nearly 1 in 5 youth have reported experiencing anxiety or depression, and 30% of high school students have felt persistently sad or hopeless, which is a sad thing to hear. And in a 2023 Vermont Youth Risk Behavior Survey, 34% of high school students reported poor mental health most of the time. And 14% reported that they had made a suicide plan in the past year. For vulnerable and marginalized communities like LGBTQ plus youth and female and women students, these rates of distress are even higher. 54% and 47% respectively report distressing mental health problems. And alarmingly, nearly 1 in 5 of these students say they don't know where to go to talk about these problems. They have no idea. So how do we solve it? And this is the moment where I think we pause and we say, it can feel hard and hopeless to solve the problem. And I'm here to tell us that we do actually have solutions and we can make a difference. These are preventable deaths. These are preventable tragedies. And we have the power to make some decisions today that will save young people in the future. Investing in universal mental health access for all Vermont youth, that's what we're here to talk about. Saluna would be available to every single 13 to 18-year-old in the state for free, no barriers to access. This is both a moral obligation, given the scope of the problem I just talked about, and a necessary economic strategy. In an era increasingly driven by what we call the brain economy, where brain health and cognitive, emotional, and social skills like adaptability, empathy, and creativity are fueling innovation and productivity in our society, youth brain capital is possibly the most important economic asset, akin to infrastructure like roads and bridges. In fact, it might even be more important because you need healthy brains to design and build those things. And given the scope of this problem, we need to figure out how to build a healthy brain economy and invest in brain capital in our communities. What we know from the World Economic Forum 2025 Future of Jobs report is that employers and public institutions that invest in employee brain health can enhance performance and potentially boost global GDP by 12%. So if we can't drive this kind of change through our moral obligation, let's just look at the numbers when it comes to the economy. Programs like Saluna offer a scalable and evidence-based solution to protect and nurture youth brain capital by providing timely, accessible mental health support. By acting now, Vermont can make a difference and boost its economy in the future. So the proposed legislation under consideration by this committee represents an opportunity for Vermont to take up the mantle of a population-wide prevention approach to building healthy communities and replicate the positive impact of Saluna that we have observed in California, where we launched a first-in-the-nation program just like this. So I'll take a moment just to level set on what Saluna is and what it isn't. So Saluna is an evidence-based digital mental health platform. It's not just an app. It's something you can access anywhere with an internet connection. Could be through your iPad, could be through a website on Google Chrome, and it could be through your phone where the app would be. It provides Self-guided resources and coping skills. So think informational articles on things like anxiety and conflict resolution, and then talking to your parents about your school homework and the challenges you're having. Coping skills like journaling, mood logs, breathing exercises, things that, young people would learn in counseling sessions. It also has a peer community forum where the young people using the platform can help each other. So they can post questions and ask for support or respond to other people's questions and provide support. This peer-to-peer support. And what we know from the research is that particularly in young people, teenagers, adolescents, young adults, peer-to-peer support is more effective at reducing psychological distress than if that teenager comes and talks to me, a middle-aged clinical psychologist. Hearing from another teenager, yeah, me too, and here's how I've handled it, very effective. It's also very scalable when we come back to this workforce challenge that we took on. I will talk about how we keep that community forum safe for a second, because it's a top question. And what I like to do here is zoom out a little bit and talk about why digital in the first place. What are the things that we like about the internet? Why do we go there? We go there for community and connectedness, and we go there for information. And the problem with the internet is that it's also filled with lots of terrible things like misinformation and bullying and inappropriate content and inappropriate relationships and peer pressure to behave certain ways. What we have done at Soluna is we take all of the good stuff that the internet offers, community and accurate, reliable information, and we leave all of the bad stuff on the outside. And the way we do that in the peer community forum is we use something called pre-moderation. What that means is that every bit of content that a service user submits to that forum, so a question, a response to somebody else's question, is first reviewed by a real human to make sure that that piece of content, that question, that response meets our community guidelines. No hate speech, no inappropriate content, no misinformation, no bullying, etc. And also, if that young person has expressed any signs of risk, like suicidal ideation, we catch that and then we work with that young person behind the scenes to keep them safe. All of that happens before the post goes live. So there is no chance for dangerous, inappropriate, or problematic information to be posted to this forum. This is different, right, from where you are, other spaces in the internet, right? If you post something to Facebook and it's inappropriate, a moderator comes along and says, hey, this is inappropriate, we're going to take it down. That's great, but you can't undo the harm that that post did in the first place, right? So we do all that moderation before it goes live. We also make sure as part of that moderation that that young person hasn't accidentally included any identifying information about themselves, because we operate on an anonymous model so that service users can't identify each other, because we want to keep them safe. And we also want to make it a sort of stigma-free, non-judgmental place, because what the research tells us is that when you create that stigma-free space, people are more likely to ask questions and seek help. I also want to point out that there is no direct messaging function on Soluna. So a young person cannot message privately another young person and strike up a conversation or an inappropriate relationship, which is another real concern that we have, right, in other spaces on the internet. So that's not possible. The only way young people can interact with each other is in that forum, and the only way they get those interactions is after everything has been moderated. So that's how we keep our young people safe there. So I talked about the resources, the coping skills, and the peer community forum. Now I'm going to talk about our coaching and counseling. So on the platform, young people can access one-to-one coaching sessions with mental health professionals or counseling sessions with licensed professionals. And they can do those sessions either through chat or by phone. And in some cases, depending on where we're implementing the model, by video. Yes.
Quickly interject a question. Are the coaches in a local area? So what familiarity do they have with the sort of the culture of the region?
Yeah, so great question, and important, right? Because cultural relevance and being able to connect with young people and the things that matter to them is a big part of care. So yes, where we're implemented in California, for example, our coaches are in California and they are mostly Californians. Same in New Jersey. But I would say it's not 100% the case because of course we have to address the workforce issue. So within all of the regulations and licensing rules, we do recruit folks all across the country, but the majority are folks who are in the state. We also make sure that our coaching and counseling teams have a diverse representation of identities and characteristics. So, we've got people of color, we've got individuals who've had experience of homelessness, we've got individuals who are first generation immigrants in colleges. These are people who can speak to the vast array of experiences that young people are having and can connect with them on that. And young people interested in engaging with one of our coaches or counselors can actually select the person they want to talk to based on some of those features. So if I want to talk to someone that has had a similar experience to me as an LGBTQ plus youth, I can find a person on our practitioner list who has that experience. So it's a way of kind of connecting on those cultural and lived experience places, which is another thing that research tells us works, which is connecting through lived experience. And then finally, we have a ability for young people to connect themselves to other local resources through our large database of community-based resources, low cost, no cost resources. So if they need help with food insecurity, housing insecurity, if they want to access in-person care, we have a curated and vetted database that they can search based on things like zip code and the service that they're looking for, and then reach out and connect to those services. So really from this kind of digital front door of, I have a question about this anxiety that I'm feeling, to I'm ready to talk to someone about it, Soluna can guide that young person through that pathway. Soluna is evidence-based and science-backed. And the reason for that is that our primary commissioner model is through public funding. And if we're going to be using taxpayer dollars to provide healthcare services to young people, those healthcare services better work. And that's the principle that the company Kooth has built itself on over the last 23 years. We were born in the UK at a kitchen table between an internet enthusiast and a counselor in 2001, where they were like, hey, this internet thing seems like it's going to be kind of a big deal. We wonder if young people will use it. Could we make this an access point for care? 23 years later, Kooth is the largest digital mental health provider for young people in the UK, and the National Healthcare Service has invested in it. Thanks to the governor of California and the Department of Healthcare Services there, they have implemented a similar model, first in the nation. Soluna is free to every single 13 to 25-year-old in California with no barriers to access, regardless of income, insurance status, ability to pay, geography, immigration status. All they need to do is give us a zip code and a date of birth for a quick eligibility check. They're on the platform. If they want to engage with our coaching team or submit to the peer community forum, we ask for an email address. So we have another way of contacting them outside of the platform in the instance of a safety concern. And off they go. They don't have to share any other information with us if they don't want to. And if they do, all of that information is protected under all of the relevant consumer data protection privacy laws, healthcare information privacy laws. We are HIPAA compliant. We're a business associated under HIPAA. And in all of the states that we're present, we follow the most restrictive data protection, privacy, and security rules, be it federal or state. And of course, being a British company, we came into this company already meeting the EU GDPR regulations, which is some of the most radical controls over consumer data protection.
I have a bunch of issues.
Yes.
I have an ask of you, and that is to ensure that we have your written testimony.
Absolutely.
And we'll get it. If you have it electronically, we can put it up on our webpage.
Oh, I love that. Yes, I can absolutely, I can share the hard copy and we can absolutely send it because it has some really great data points about how the project and the component, but I bet it'll come out in questions.
Yeah, thank you very much. This is really interesting. I was a high school teacher and one of our refrains was meet kids where they're at.
Yeah.
So I appreciate this is where they're at and this is where we're meeting them. I also want to just ask about the irony of knowing that screens are detrimental to youth mental health and at the same time, like drawing them in to receive care in that space. Can you talk about that?
Right. How do I manage that tension?
Yeah.
We were just having this conversation. I acknowledge the tension and, we do acknowledge it as a platform. I think The key is to recognize that online spaces, digital tools like phones and watches, they're here. And like you say, young people are going to them. So how do we direct them to safe spaces and to healthy use? So one of the things that Soluna is designed on is goal-based approach. We encourage young people to develop the skills they need to set their own goals and work towards them. And for many of young people, their own goals are, how do I reduce my screen time? How do I take care of my health? How do I build the life I want to live? And what we do, our practitioners, our content, it encourages what we call healthy phone use. So I suspect many of us in this room this morning, probably one of the first things we did when we woke up after switching our alarm off was open our phone and do some sort of scrolling, either checking your email or looking at Facebook or whatever it is. Can we replace that morning behavior with opening Soluna and doing a breathing exercise or a morning meditation? Can you replace it with a white noise generator that you put on while you do some sort of other physical movement? You stretch, you wake up. How do you do healthy phone use? If it's the thing you're reaching for, how do we change the reason you're reaching for it? Same thing for in the evening before you go to bed. Instead of scrolling through Instagram and getting activated at all the ways you're seeing peers behave that don't match up with how you feel, can you instead do a little journaling or track your mood or respond to a peer community forum and provide support to your community, actually contribute rather than receive? So it's about redirecting healthy phones. Soluna, we are agnostic to whether a school chooses to ban phones or not. We're accessible outside of school hours. And in fact, nearly 50% of our coaching sessions in California are happening outside of 9 to 5. Young people are reaching for Soluna support outside of the traditional hours where they would have access to other support.
Awesome. So I have a few other questions. You mentioned that it's paid for by, so it's government funded. Is there any advertising involved at all?
Yes. So part of the cost of the platform is making sure we're including really effective community engagement and marketing strategies, because we have to find youth where they are. They're in education settings, they're in digital settings, and they're in healthcare settings. And so what we do is we have a sort of multi-pronged approach for engagement. We've got a sort of feet on the streets approach. We've got youth ambassadors, we've got community engagement leads, we've got people like me going out into the community, providing education, trainings, answering questions.
I'm sorry, are you generating income through advertising?
Oh, thank you for clarifying the question.
Yeah.
No, we are not. There's no ads. Absolutely not. No.
Great, thank you for that.
We spend money on adverts to get people to come to the platform, but we do not.
And my last two questions, do you have data from England as to how effective this has been? And also,
California, New Jersey.
yeah,
Yes.
but it seems like it's been around in England for
The longest, yeah, but we have a 15 months worth of data in California as well. So we should have both. Yeah.
That'd be super. And then my last one was just, I'm less concerned about the danger of the platform versus the data gathering. But it sounds like you're following FERPA and
Yes,
all the other.
GDPR, and yes.
I'm still scared.
And that's okay.
Yeah.
I think we should acknowledge that, right?
Yeah.
Because
Especially in our current
current situation.
situation with a malevolent president and government. I'm
Yes.
very scared of the data gathering.
Yes, I can speak to that, and I share that concern. So thank you for raising it. Yeah. Let me start with that, and then I'll talk about our
I'm
scientific.
going to ask if we could just do that quickly,
That's okay.
and then we'll have to move on. Yeah.
Absolutely, thank you. Very quickly, as I said, we don't require our service users to give us any information beyond the zip code and the date of birth and an email. They can choose to fill out their profile with things like race and identity and other stuff, and they can choose to tell the coach that information, but they don't have to. If they do, it's considered either personal identifying information or personal health information, and is governed as such. We cannot release any of that information.
Like IPO addresses and stuff like
We
that.
don't track those IP addresses, no. And we don't do any kind of, you know how other companies do this sort of marketing cookie tracking to find out where people are going. We don't do any of that for privacy reasons, because it's a really vulnerable community. We don't sell the data. We don't release the data without permission from that young person or unless it is contractually obligated. So we are contracted with the Department of Healthcare Services in California. Technically, California own the data because it's taxpayer funded. So the taxpayers of California own it. So our contract has requirements in that we share that data with THCS. They are, of course, governed by all of the strict rules around healthcare data.
Yeah, the parts that you just said though about permission from the student, I mean, no one's reading through all of I mean, I shouldn't say no one, but few.
Most people aren't.
reading
No,
through.
you're
Yeah,
right,
so
yeah.
permission is tricky.
Yeah, we do our very best. We go above and beyond the best practices for getting informed consent. But I think a discussion on the nature of informed consent is something I would love to do over a drink. And how do we really do that well? But we do it to the best of our abilities, and we make sure that young people know what their rights are and how to effectuate them. Yeah. Some quick highlights on effectiveness and impact. So in the UK, we did a health economic study in partnerships with the York Health Economic Consortium and the NHS. And from a return on investment perspective, what we saw is when we implemented this model in the National Health Service, we had a 3x savings in other areas in the healthcare system downstream. Reduced pediatrician visits, reduced antidepressant prescriptions, reduced ER visits for self-harm and suicidal ideation, reduced hospitalizations for those things, and reduced behaviors in other areas of health that cost health system more money, like smoking and substance use. So there's a clear cost savings of implementing what we call an upstream preventative public health program with these downstream services that cost us a lot of money. And in the current environment where we are facing big cuts to Medicaid, where we are facing real squeeze on an already squeezed system, investing money in prevention services that save you money elsewhere is a very sensible thing to do.
So you're preaching to the choir in this room, but I appreciate it very much. And I think we'll have to end the conversation for now, but very much appreciate your coming in and giving us all the data and information, and having it online would be terrific.
Yes, I've got some great data points
Yeah,
there for California for you to read
That's
through.
good. Senator Douglas, one
Very
quick
simple
question.
question, simple question. You
Yes,
said in
sir.
your testimony that there was a bill will be added.
Oh, perhaps I misspoke, but there's a consideration for.
I have some language that we might want to consider.
Thank
but,
you. Yeah, I
we're
apologize.
at a very late date for putting anything new on the table.
Understood.
However, we have talked about Soluna in the past, and we'll see where it goes.
Thank you. And thank you
Appreciate
for correcting that.
Yeah.
Thank you for your time.
Thank you. Thanks for being here. Very much appreciated. So, committee, we're going to move on to H401, which is the Food Manufacturing Establishments Bill. And after we had testimony, we heard from Department of Health about some language that they might want to suggest. So who's speaking? Julie Errol, who is our interim.
She's online.
Oh, there you are. Okay. Thank you for being here, and congratulations for the interim commissioner of.
Thank you, Senator Lyons. I appreciate that.
So, and you have with you Elizabeth Worsing, and we're looking at H104. Do we have some language from you, I think, on our webpage. So why don't you two go ahead? Before you do that, I am going to have the committee introduce themselves one more time so you know with whom you are speaking.
Senator Larry Hart from Orange County.
Sam Douglas from Orleans County.
Ginny Lyons, Chittenden Southeast.
Martina Rock-Ulick, Chittenden Central.
And Cummings, Washington District. So that's us. And now please introduce yourselves. And I'm thinking you're going to offer your testimony together. That would be great.
Yes, absolutely.
Good.
Thank you. And good morning. Yes, I am Julie Errol, Interim Commissioner at the Department of Health. And joining me is Liz Worsing. Liz, would you like to introduce yourself and your role?
Thank you. Hi, everyone. Liz Worsing, Director of the Food and Lodging Program.
So we'd like to thank you for having us here. It's a pleasure to be here this morning, and we appreciate the opportunity to be a part of the conversation today. The department supports the goals of H401 and recognizes the need for modifying the law to better reflect the current marketplace and to address inflation. Although the department is generally supportive of the objectives of the bill, we do have some concerns that some of the approach in H401 may result in a greater risk to public health. Ensuring the safety of food is a critical public health function. Food safety practices are guided by widely accepted science that defines which products are potentially hazardous and which products are lower risk. Different types of food require different preparation methods and controls to ensure that they're safe. Certain types of products, if improperly produced, could result in serious foodborne illnesses, such as salmonella, listeriosis, and botulism. Salmonella bacteria are a leading cause of foodborne illness in the US. Anyone can get a salmonella infection, but young children, older adults, people with weakened immune systems, all have increased risk of infection and may become seriously ill. Listeriosis is the third leading cause of death from foodborne illness, with an estimated mortality rate of approximately 20 to 30%. Although some people with listeria may not have any symptoms, it's especially harmful for pregnant women, newborns, older adults, and those who are immunocompromised. Botulism is a rare but potentially fatal illness where bacteria attack the body's nerves and cause difficulty breathing, multiple muscle paralysis, and even death. Common sources of botulism are homemade foods that have been improperly canned, preserved, or fermented. And while we fortunately have not had any recent cases of foodborne botulism in Vermont, we have an annual average of 3 cases of listeriosis, with 5 last year, and more than 100 cases of salmonella infection annually. A quick note on case counts: foodborne illness rates are likely much higher. Many people who become sick due to a foodborne pathogen do not seek medical care, and we would not know about their case. The department's goal is to prevent food safety issues before they happen. We know that food manufacturers want to ensure that the food they produce is safe too, and we will continue to work with and support small manufacturers to keep food safe without adding unnecessary burdens. So to that end, the department would like to suggest an alternate approach for updating the current food manufacturing licensing framework that would be consistent with other states, better protect public health, while also preserving and expanding many aspects of the home business landscape that's existed in Vermont for many years. The department recommends that the bill be revised to more closely align with similar laws in many other states. We've submitted an analysis to the committee that provides a summary of these laws in northeastern states, as well as other key state examples. Other states largely limit the types of food that can be produced for sale in home kitchens exempt from licensing, based on the potential risk of certain products and the more limited ability to achieve the proper time and temperature controls needed to ensure the safety of certain food products. In most cases, exempt home kitchens are limited to producing non-potentially hazardous foods for sale. These allowable products are based on the food safety risk level associated with certain types of food. Non-potentially hazardous foods are those that don't require time and temperature control for safety. For example, potentially non-hazardous foods include baked goods, candies, jams, jellies, dry herbs, trail mix, granola, mixed nuts, flavored vinegar, popcorn, coffee beans, and dry tea, are some of them. On the other hand, there are products like kimchi, salsas, hot sauces, and other sauces, and innovative products like fermented cashew teas that require time and temperature control for safety. If these types of products are improperly canned, preserved, or fermented, or not maintained at the proper temperature or pH, that could result in serious foodborne illnesses. Because of this risk, most other states require food manufacturers producing these types of products for sale to be licensed and prohibit these types of products from being produced for sale in home kitchens. The department has submitted guidelines from Connecticut that outline the types of foods that can and cannot be produced for sale in home kitchens under that state's cottage food law. This is an excellent example of simple guidance that can be provided to help cottage food operators understand the different types of non-potentially hazardous foods that can be made. In addition to limiting the types of food exempt from licensing requirements, many states also require exempt operators to complete training, registration or filing processes, and labeling of food made in a home kitchen. Vermont already has a simple labeling requirement. A short PowerPoint training similar to the materials the department has submitted from Minnesota is the approach that the department would take to training. The exempt food manufacturers could view it on their own without any expense. Training can not only help to protect public health, but also support the business owner with a no-cost, simple way of getting important information. We know they want to produce safe products, and this is one way to help them in that goal. The addition of an annual registration would help the department provide support for small businesses and add to our understanding of the cottage food industry in Vermont. The burden of submitting the form would be very low. It would be online. We already have one online. And could include a simple attestation that the business owner had viewed the training. Our goal is to achieve a balance between protecting public health and supporting the business owner while keeping the training barrier low, but still informative and helpful. To better align Vermont law with similar laws from other states, the department provided a bill markup to the committee. The language suggested by the department would define cottage food operator, and cottage food product. The definition of a cottage food operator would include only people who produce or package cottage food products in the home kitchen of their private residential dwelling. Definition of cottage food products would include only those foods sold by those operators that are not potentially hazardous food or not a time temperature control for safety food. And the definition of cottage food operation means a food manufacturing establishment where cottage food products are produced. The proposed language would also keep the existing language of section 4353A3 in the current law, including the exemption for food manufacturers with gross receipts of $10,000 or less, would add a new exemption for cottage food operators with gross receipts of $30,000 or less from licensure requirements and related fees, and would require food manufacturers claiming a licensing exemption to provide certain documentation to the department, including an annual licensing exemption form and an attestation of training completion. And it would maintain the current requirements in the Manufactured Food Rule, section 6.2.1, for exempt producers, including labeling requirements for products made in an exempt food manufacturing establishment. The department welcomes the opportunity to work with the committee and other stakeholders on this important effort. It's not an event, it's an effort. And that's it for our testimony, our formal testimony, but we're certainly happy to answer any questions.
It would be great if you could send us that testimony. We have what other states are doing, Connecticut, and then we have your recommended language. But if you could send that in, that would be helpful.
Absolutely.
All right, terrific. Is there anything that Elizabeth, you're going to add?
Liz is here backing me up on the technical questions.
Okay, that's good. I was looking at the language that you sent in, and we'll have to take this up probably another day with Ledge Council. But it looks like you have language related to 4353A3. What exactly does your language do to the bill as it's currently written? And just very briefly, because we're going to run into, we need to hear from our joint fiscal person as well.
Yeah, so briefly, what our change does is creates another category for cottage food operators. and limits that category to non-hazardous food production. As we went through the different types of food, it would retain the $10,000 annual exemption for not hazardous foods, those foods that may be more hazardous. But it wouldn't raise that. The current bill that you have in front of you would raise both manufactured foods and baked goods to the 30,000. We're trying to create a separate, a different category for cottage foods that includes more than baked goods. It would include other non-hazardous foods and that, but keep the limited $10,000 limit for those foods that may be more hazardous.
Thank you. Yes, that's really helpful. Okay. Committee, any other questions for Interim Commissioner Arrow?
You talked a lot about food safety. There isn't a lot in the bill that's specifically about food safety. And with what I think I'm getting from you, as it stands right now with the cottage laws that we currently have, ignoring this bill, it seems like from what you're saying, we still have the same food safety concerns with the current laws, with the current foods that people are still producing in their homes. So, using the testimony you just gave, I can make the argument that we shouldn't allow anybody to make any food in their homes for sale. And I've worked in kitchens basically since I've been walk, and I would rather eat food that somebody made in their home kitchen and then sold at like a farmer's market than eat at a restaurant. I still eat at restaurants, but I know that just because you have licensing requirements, just because you have hand washing stations and all these different food safety infrastructures, it doesn't mean that it can be made to a standard that can avoid all the things that you spoke about. So
I think what we heard is that the $10,000 cap would remain for those foods for which there might be concern, like pressure cooker foods or raw milk or others. And then the cap is raised for other things that don't currently have those food safety provisions in place. And that's what we'll have to clarify that as we talk with Ledge Council. But good question, Senator. So are there other questions right now? I'm going to move to our Joint Fiscal Officer, Ted Barnett, who's here. And Ted, just to go briefly through the fiscal note for 401, that would be helpful.
Sure. For the record, Ted Barnett, Joint Fiscal Office. The fiscal impact of this bill is pretty straightforward. We're estimating really a minimal impact to revenues for the Department of Health's Food and Lodging Fee Fund. We're not able to pin exactly how minimal that impact is because the department does not collect information on gross receipts of small food establishments, or whether they're at home or a non-home establishment. However, do want to note that the changes as the bill moved out of the House are marginal within the context of the fund. The fiscal note has some information about the receipts. So in fiscal year 24, the fund received approximately almost $1.5 million in revenue from various food and lodging fees. So this is a pretty broad universe. And of that broad universe, the two fee types that this legislation would primarily impact generated $26,000 in annual revenue. And by lowering, there could be some revenue loss by increasing the exemptions. However, there's a threshold that is lowered for the $275 non-bakery food establishment fee. So that would provide some additional revenue compared with current laws. That might all be a wash. I'll have to say pretty minimal. There's a table on the fiscal note that shows the universe of these fees within current law, just to get a sense of where we're at. This doesn't kind of make any estimates, but it might be helpful for your review.
Okay. Thank you.
Of course.
And the suggestions that were made by Department of Health, would those, if those suggestions were included, what effect, if any, would they have? We don't know.
It's still within, I don't think I would change it from minimal
Yeah.
at all. There might be, I think there would be fewer exemptions. And so the potential, if there was a revenue loss, would be lessened. But yeah, I would have to spend a little more time to confirm if that was actually the
Well,
case.
so we haven't made a decision about those. We'll talk with Ledge Council about what makes sense. Questions for Ted? We're good. Thank you. Thanks for
Great.
being here this morning,
Of course.
helping us. Thank you all for your input on this. We'll look at it and then we'll put the bill on our agenda another day so we can have a discussion with Ledge Council and fully understand what we're doing here. We don't want to turn off the bakeries of the world, and we don't want to close down our local food processors. At the same time, we want to keep our population healthy. Okay, so we're gonna wrap that bill and we're gonna move on to Katie, we'll come back to this. Okay. And we're gonna move on to our budget. Right up.
What's that?
Why don't you just write?
Okay, you want stuff on the screen or no?
Yes, I don't know, but if people want stuff on the screen, I think it's probably helpful for people who are looking at the screen.
Okay.
Yeah.
Oh, sorry, Beverly. Heights and please. Thank you.
We have a heavy lift in front of us, and the heavy lift is also being felt down the hall of appropriations. This is not an easy process for us. And I think we're gonna have to make some decisions. I know that some of the decisions that we make in here as well as down the hall are not gonna be happy ones for anybody, but our life is being suffocated right now. Another place.
Which chart would you like to start?
Well, you just have a brand new one, and so I'm thinking that's the one you probably would like us to pay attention to. And tell us how it's different from what we had yesterday.
Sure.
If at all.
Noel Lang, joint fiscal officer. It's the same chart
Okay.
as yesterday, same charts. The difference is that, I made some corrections. For instance, there was one thing that was in the wrong chart. It was in the budget. I didn't capture it. There were actually, I tried to reduce duplications. I found one or two more duplications and then I found some typos. But I kept the numbering the same. So if something came out, it might go 1, 2, 7, 8, 9, 12. And I did that so that the numbers, so that people wrote on them and we were referring to numbers, the number line number would still be the same. So, otherwise, just a series of small corrections that most people wouldn't notice. It's just cleaner and more reflective of, you know, like I said, this is a work in progress. So, so which chart would you like me to start with? Would you like to, or why don't you start talking and I'll pull up whichever chart meets your needs.
Well, I guess I'd kind of like to hear from the committee. Did anybody send me bullets last night? Okay, well, let's do this. Let's share thoughts that you have right now, just your global thinking about the direction you're headed for your priorities. That would help me a great deal. I did share with you yesterday some of my priorities regarding going upstream for primary care and building on that. And then, so who would like to offer any thoughts? Senator Cummings. It's overpowering. Yeah, I can't sit here and, pick and choose. I think until we know where we're gonna land, we need to start with the basic safety net programs, like food, shelter, primary health care. We need to make sure that we're supporting existing programs that are effective before we expand or start new ones. And then if things turn out well, I think we may be back here in September. We can expand or contract, but I'm starting to look at making sure that the safety net is solid and that anything over and above that remains to be seen. Thank you. That's really well said. Anyone else want to add a thought? Does anybody disagree with what Senator Cummings just said?
No, I would echo what she said. I think that's sadly just where we are right now, and the news about this year's economic picture is not good.
Yeah.
I know you referred to that yesterday, and I did a little digging, and it's, visits are down over 30% and so on. So it's fairly bleak, and I think we need to prioritize keeping people alive, as I've said. That said, also, as I said yesterday, I'd be remiss to not advocate for recovery, because in my district, it's a huge issue. Helping the homeless, but recovery is top for me.
Although, concur with Senator Cummings. What I wrote was, I want to prioritize programs that are efficient, effective, and can prove that they're responsible stewards of state funds. I think that's not controversial. Tax laws are precious. Vermonters in my county and EPA as a whole want efficient use of state funds. Prioritize programs and organizations that allocate funds towards helping Vermonters, not just towards administration, like to CEOs and executive directors and lobbyists. I also concur with Senator Mueller about recovery. I think that's an issue, and I like, especially I like the recovery residences because it's very effective for treating substance abuse. And it's not just sticking them in a holding pen and then letting them detox and then send them back out. It's actually ongoing, and so again goes back to effective.
Senator Hart, any comments?
Yes, I'm actually sending you a message now.
Why don't you just share it?
Okay.
Yeah.
I will just share it then. I still have concerns with 103. There's no money appropriated for them. 103 Vermont. So I still have concern that 182,000 might not be enough for that program. But they haven't even incorporated anything for that. The House didn't even go or didn't.
Okay.
So I still have concerns about that.
And so are you agreeing with what you've heard from Senator Cummings, Senator Zulik, and Senator Douglas?
I did.
Okay.
Well, because food is a basic need, so.
Yeah. And I do mirror your recovery stuff. I can mirror that to the top.
So Nolan, I think the place we should start with that in mind is to go to what this single sheet
Sure.
briefly to what is currently there in the budget
Yeah.
and what is in the house, what the house has recommended. Because I think it does lean toward some of our concerns.
Sure. And I also have a couple of suggestions on ways that you might approach this.
Thank you.
One would be, rather than go line by line, and when the House went through and they had, here's our top 4 picks based on what we heard, you could do it that way. and we can do that right now, which is fine. Or B, since people seem to be agreeing on the principles, but not on the specifics, you could write a letter saying, here's our priorities, and we recommend this percent appropriations budget based on these principles, and then leave it to them to specifically pick. Or you can do a hybrid of both.
Let's do it. Let's do both. I mean, let's start with the principles that we have that
Sure.
we've been talking about. And I think that, I would start with primary care moving upstream. I would start with the safety net concerns about having, investing in our current safety net programs and avoiding expansion at this time. And then, meeting basic needs such as hunger and homes. And we have H91 with us, so we aren't necessarily finalizing that today, but, so I've heard that. And then, I've heard there is some money already in the budget for the recovery residences, and there is some concern about the recovery campus and the language that we don't have. So I've been working on that down the hall to see what we can do. But my enthusiasm for the recovery program is dimmed somewhat because we had asked for a report that will come out in the fall that will put things together and demonstrate, where we need to have that mid-level, those mid-level recovery services. And part of that will be planning, of course, but, so to give money out where we don't know where it is and how it fits within the system is difficult. Even though we value what the Recovery Partners of Vermont tell us, it's not within a broader context. So I'm just saying, just keep that in mind. I carry that thought with me wherever I go.
There should be, but some assessment. Track record.
Yes,
What do you produce?
yes.
And also, what's your ability to raise funds elsewhere?
I need that.
We're definitely going to need that. I don't know what Hunger Free Vermont is going to spend $182,000 on. It's a choice between that and the food bank,
Going to the food bank.
which directly supplies food to people. I think
I think you're echoing some of the comments that I've heard from others. Good. Go ahead.
Question about what you just said about recovery centers. I know that the individual organizations like Turning Point, for example, they have a lot of data.
They have a lot of data and they're very successful.
Yes.
Oh, got it.
Yeah.
Understood. And then we have new proposals without
Gotcha.
any copy edit.
Another approach to help you think about or address this could be, so the orange is, this is the house's priorities.
Yeah.
Right? You could look in pink compared to the orange and say, is there anything on the pink that's a higher priority for you than in the orange? Right? So I'm just trying to think about ways to help you come up, because you hear it, oh, the house didn't do this, the house didn't do that. Well, is there anything they did do that, although you may like, there's something in the pink that you personally find is a higher priority over maybe something else? I'm just trying to think, because we're operating in a zero budget, right? Zero sum. We're not raising revenue, so we're trying to fit within a specific box. So everything you add, you have to find. There has to be a subtraction
Somebody
somewhere
has
else.
to find
Well, is
money.
that true? Because we haven't been given a number.
No, we're not doing that. We're not. That'll be something that
Yeah.
happens.
Yeah, the House passed a budget that fits within the framework,
Yeah.
and you're operating within that framework because finance has not been raising.
someone let me do my job.
So you are operating within a box, and they're operating within a box, right? So doesn't mean that a cut in healthcare or an increase in healthcare comes in a cut in healthcare. Maybe they find it elsewhere. But my point is, if everybody comes with them with asks, they have to. Right now, they're looking at how to. They have $80 million in asks outside of this. How are they supposed to prioritize? And so one of the jobs of you guys are to help them set their priorities about what should be in there over something else. everybody wants everything in,
Oh, yeah.
but in this constraint.
Well, frankly, I like everything in too, but we don't have the money to do that. And we're trying to make some concrete decisions that'll help Vermonters across the board without frankly breaking the bank. That's where we are.
No, I have questions. Number one.
Okay.
Here it says it's, section 1100E1. And it's ACO transition sash and blueprint, one time to backfill loss from Medicare dollars that went to OneCare. And then 1100R2, which is not in the budget, is 4.5 million general fund one time to continue population health management payments paid by OneCare Vermont through 2026. My concern is I want to make sure that the primary care practices that we're getting annual payments through OneCare continue to get those continual payments so we don't lose them while we transition to a head if a head is even still there. Anyone tracks the meaning of the E. But that's beyond my pay grade.
But I'm with you on that.
But I want to make
And I know the
sure
BAA
that
has some language with that.
those that no primary care loses the funding its head
I know.
through OneCare.
Yeah.
And when it gets the sash and blueprint, it's beyond me.
So the governor proposed and the House concurred with the 10.8, it grosses up to 10.8. This is number one on the orange.
Mhm.
And as the backfill, sash and blueprint payments, the Medicare part.
Okay.
And then the other one you mentioned, the 4.6, that's the ask. It's 3.1 in the budget. The ask was for 4.6. There's
Additional.
they're asking for additional 1.5.
Is that the residency program?
It's a population
Yeah.
health management
No,
payments.
okay.
So they asked for 4.6 and there's 3.1 in the budget. So they're asking, I can't speak for them whether they're looking for the gap or an additional, and either way, they're looking for more.
So sure, in terms of working within the box, then we had talked about looking at some of these asks and seeing if there's possibility of reducing any of them so that we can keep the organization or their work whole while maybe bringing.
And honestly, that would be a suggestion we can make to the appropriations committee, that these are our priorities. And we would like to save them as much as possible. And if we have to reduce one to pay for another, let's do it without full harm. You know, sometimes if you reduce, people can't do what they say, and then it's a failure anyway. So
The third approach that you could
go
take
for it.
would be, I'm just trying to think of ideas,
No,
is you could say, our committee has reviewed both what's in and outside of the budget. And we've concurred that these 5 are our top absolute, we really, really want them in. So that's another way, but then you have to start voting on which ones and whatever.
yeah,
I'm just trying to come up with different ways
Yeah,
for
it's
you
hard
to.
for us. I don't think there's so many line items here
I
that
know.
relate to all of that. I think doing what your first suggestion is very helpful in saying these are our principles. And within our principles, such as primary care, right? Number one, and then such as basic needs, food bank, or reach out, or supporting the network as it currently exists. Those are our DAs, our SSAs, the SASH, those programs, both for, I look at primary care and then at long-term care, the two ends of the spectrum where we're seeing the greatest pressure, either for people leaving or the needs that are increasing. That makes a lot of sense. Okay. But next. So can we do it that way?
You can do it any way you want. There, you know, it depends on what level of guidance you want to provide them. Do you want to provide them with principles, or do you want to provide them with specific things that are very important to you?
Yeah. well,
Or
okay.
both, but I think we have how much time to do?
No, I just, what I think that we've got our principles in place. Let me rephrase what I'm hearing from folks. To emphasize our prevention and upstream primary care, to emphasize our safety net programs, and to emphasize recovery requests and recovery programs that currently exist, expanding those that currently exist, and then basic needs like food. And we have two ends of the spectrum for primary care. When I think of primary care, I also think of our adult days, our SASH, our DAAs is critically important for the safety net. Bridges to health. Quindy.
Okay, so I hear emphasize safety net programs, recovery programs that currently exist, basic needs, prevention, primary care.
Right, and then we have long-term care, SASH,
Well, those were all buckets
Yeah.
within them, so I'm trying to think of the broader.
senators.
I see some questions on 10, 11, or on the orange, the power center. So the governor took it all out in the House, but all that. I know, I know the governor's a strong supporter of mental health and everything, so I wonder why he took them out. And then why the House just put it all back and not a portion of it back.
So those are the kinds of questions that we look at down the hall. And you'll have to ask the governor why he didn't recommend it.
And I also on line 11, I was just wondering what first calls crisis workforce is a little bit more. I don't know if we have anything. Private center.
Crisis workforce,
Yeah.
first call, and the ones that go out are centers when someone is in real trouble. And maybe we could prevent needing that if we had the saloon app for kids. And I'm not joking, but I mean, we have to do something for prevention. Kids
I used
for mental health,
to call the Washington County SWAT team,
yes.
and I did have their number on speed dial. But I'm super kidding. Don't call it any crisis, but they're the people that respond when I get the phone call saying I'm standing on the bridge and I'm going to jump off.
Yes.
Then beyond my skill set, and I call them because
Yeah.
we do, and they get, at least when the state hospital closed, they got called frequently within the city of Providence.
It says there was a bed in the pediatric office.
That, I don't,
That's part of what's confusing.
yes, that to me is a news. Well,
Yeah, because I'm very familiar with local crisis.
yeah,
teams.
that kind of thing.
Yeah, very familiar with that, but
Well, so you'll have to ask the governor his reasoning. What we look at down the hallway is what comes to us from the administration, and the administration supports. We hear from everyone in the administration. And they represent the governor. And then we hear from the organizations. They represent themselves and the interests of their folks. And then we put that into the context of what we understand in our own policy committee here. So if you want to adhere to what the governor said, you're welcome to do that. But there's more than one entity in making decisions in the budget process. Okay, so where are we, Nolan?
We are still principal. No, I mean, that's all I have.
What do we have for principles?
I
Do we have any?
Prevention,
principles?
primary
Do we
care.
have any principles?
We do.
We do, yes, okay. You're going upstream.
Yeah, just have prevention, primary care, have safety nets, recovery programs that currently exist, basic needs
Right.
categories.
And then within that, we're looking to cover the gap year of 26. We're looking to ensure that we have stable DAs, SSAs, SASH program going forward, so those safety net programs going forward. We're looking to ensure that we have sufficient support for folks in recovery residences. I'm hearing that. And then we're hearing that there are some very basic needs that should be met. There's nothing, I don't think there's anything too much in here on reach up, but we've talked a little bit about reach up.
There's one thing on the rateable
The
reduction
rateable reduction,
that doesn't have no number on it.
no money.
There's language around doing study.
Well, that'll be a debate about whether we can put money in. And sometimes we're putting money in and there's also a study, and I always think, why are you doing one?
Well, the asks from the Voices for Vermont's Children, that's all directly related to each other.
Yes, it is. And that's language, a lot of it. And then there's,
If I may frame it again, I'm
Please.
just trying to help you frame,
help.
and you might not like this frame, but
We always like what you said.
imagine, except for the chair, and everyone else, imagine you're on Senate Appropriations. What information would you want that would be helpful to you from the committees to help you make decisions? Right? That's to me, like, if I'm sitting on appropriations and I just get a vague letter supported off from the committees, that's not helpful to me as an appropriation member. But if I get principles or priorities, or I'm like, okay, I do find that. Right. So I'm just saying, put yourself in those shoes, because these are hard decisions to make and there's not a lot of time. So I'm just trying to help come up with different frameworks to approach.
Can I make a suggestion about that?
Please.
So what would help me when I'm down there, because I need to represent this
Yeah.
policy committee. Look at what the House has proposed. And then let's just scan ourselves through the list that we have. And is there anything outstanding in the pink sheet that we would like to identify? So,
The thing that would help me on appropriations is numbers. How many people have you helped? You know, what am I buying for X million dollars or X $1,000? What's costs per person? I mean, I've got a recovery house. That's good. How many people, how long do people stay? How many people actually?
now
Go
you're
out and
asking the
live.
question that I keep asking of our recovery residences and our recovery campus,
Well,
which
everybody
we don't have.
There,
I will say that in
No.
H218, they do have some stipulations tied to the appropriations in there about tell us what you've done. Not saying you should do this for all of them, but some of them you might. You could put language, in 1100, the one time we're gonna give money to X, so please provide us a report by such and such date and outcome.
but what's tricky with recovery is that it's so individual. It's
Right.
so that it's hard to quantify.
Yeah,
And it has to be flexible. So
But if
That's-
one place is keeping people for 3 years, and another place is keeping people from a year, and they have less recidivism than the 3-year folks, then then I need to ask the question, why? Are you getting more acuity? But it's those evaluations, if we can just fund everybody. But if I've got to make hard decisions, then I need some data. Yeah, I need to be able to evaluate where's the best place to invest my very limited resources right now. What do I absolutely have to keep standing up? And what are the alternatives? If you don't expand recovery residents, where do people go? What are the other alternatives out there?
ED.
I know where we know where they
Yeah.
go. They go on the streets and they go.
Okay, so bringing us back to pink and orange.
So, I mean, are you gonna say something? I'll say what I said yesterday, and I'm probably gonna say till the end of the session. I think appropriations knows this, but I mean, you can't say it enough. We're in a constitutional crisis. We have a president and an administration that's gutting our institutions and gutting our funding. And so We are in a
Creativity.
crisis moment where we have to keep people alive, and that's our focus. So whatever can be done as a safety net, as a means to keeping people alive in these very frightening times, is what we need to be focused on. And then if there's leftover, we can do all of the other wonderful things we want to do then that we know are important.
So I think that is what's guiding our principles and definitely guiding our principles. And so some creativity is going to be necessitated. But, yes. Yeah, the black cloud of authoritarianism is crushing us.
Yeah.
That's
Yeah.
that's going to be my mantra.
It's all
You want
helpful.
more specific?
I put that under safety net.
It's understandable.
Okay.
We can't, I mean, we need to be pretty specific here. So we're looking at things like the blueprint, primary care support, FQHCs, which are primary community health centers. Those are critically important. We're looking at SASH. We're looking at our DAs and our SSAs. We need all of those things. And then we need fundamental support for people in recovery. And we need people need basic needs. So we want to reinforce those basic needs. As part of all of this, we'll be looking at the money that's coming in for childcare and how to appropriate that. It's not that we are ignoring all of that there. We aren't ignoring some of the smaller asks that are here. And frankly, what the House has done has been terrific. If you look at what the House has done, I can't disagree with some of their choices that they've made. Our bills that we pass out of here will also be considered down there. So we need to just say our bills are important to us, including H91 that hasn't gone any yet. So, and then if you look at pink, what on pink, a lot of what is on pink are if we were to make changes, it would be increasing the appropriation that the House has already recommended. And then there's the Vermont Care Partners language request. I'm working on that separately. We don't need to deal with that.
Yeah, I was looking at
Which one?
4 on the pink, that is adding the adult days.
Yes. Well, that's the conundrum is where and how adult day is included in that.
Yeah, the conundrum is, the advocates are saying that adult day is included. AHS is saying they're definitely not excluded.
Excluded or included?
The adult day, the advocates are saying it is excluded. It's not included in the 2%. The agency is saying it is included in the 2%. And I don't have any way to reconcile that.
That's problematic.
Yeah, I don't know how to, I mean, I have ideas, but I don't, so I don't have an answer for how you could approach it. So I know they're saying it would be 75,000 more for skilled home health. And then I didn't have an actual number for what the adult day difference is. It's probably not very big either, but so you could in your letter say we want language that specifically ensures that these get rate increases. You can do it within the appropriation that's there. Say, and in which case everyone maybe if it is included, it's great. If it's not included, everybody gets 1.89%. I'm just throwing an example. Or you can appropriate the money and
honestly,
say, make sure they're
I
helping.
think what we want to do in here is say, yeah, we support adult day, and how we do it is going to have to happen down there.
You could say,
Yeah.
please ensure that they're covered. You can
Right.
have language that says that and then make the appropriations to
So
determine.
can we do this? Because I'm doing this in my head right now, going down the list on pink. And we've covered recovery centers. We've got the opioid funds as well. Then we've got, then if I go down to the blueprint and Dulce, for me, that is so important to, I'm on number 9. To continue that continue the existing sites, the pilot, or
Are we going to get results from the pilot?
you should.
Okay, is that what
You can't get results till you finish it.
How long?
3 years. This is third year.
So we,
I
I
think
think
it's
it's in the third year,
This will be the third year.
so I thought, because I thought we did it. My
SASH was good. We added the SASH pilot last year and we want to.
I wasn't here, I
Yeah.
remember those.
Yeah, they'll say, that's part of the primary care that we're supporting. Then the question around all the residency programs and so on, I think while we would like it, we're going to have to see what we can do and what we have in order to do it.
Medical, the AMA allow for more medical students to be accepted in the program. It's like a 3% acceptance rate. Just wanted to.
Where was that? We put a bill in on that. We'll tell the
Let's put a bill in.
national AMA to get their act together. We can do that. So I'm gonna keep moving on. So the base funding for responsive readiness has received a lot of conversation down the hall to the Vermont Food Bank, where they're putting food aside, buying the food and then holding it in case of emergency. Let's think about that. That was 17. And we want the food bank to be funded to the extent practicable, period. That's one of our basic needs. Then if we go to the second page, number 22, Children's Integrated Services. Again, it's like the safety net looking to help families who have children with special needs. How they. Are you coming back at all, Viva?
Yeah, I'm gonna see.
I know.
Principal is in his office.
Yeah, okay.
I'm gonna meet with these people.
All right. So going through the list, folks. I'm gonna drop down to Bridges and Quigley Medicare Savings Program. I think we really definitely want that. The 155 a base and the one-time 515, those were important to us in our discussion.
Madam Chair, was there anything, and the other ones in the pink, we kind of blew through them, but did you say that you want them included or you said?
Which one?
Any of them, because you said, I like this, like that, but is that you saying that you want them included or are you just saying you're like, and I haven't been tracking?
Food bank, we want included, but I don't know how much we can include.
Okay,
And I think I heard I didn't hear from anyone on the Children's Integrated Services. It's something I would value.
What number?
22.
The Parent-Child Network, that's a new program for prevention if we can find money for it. What I'll do is, for that one, I'll represent if we can find prevention funds in our prevention fund for that, I might support that. But there are a lot of things that we might be able to do.
Can you speak a little bit more to number 22 at all?
22?
Yeah.
Right, it helps pay for children with special needs. It helps pay for assessment of those cases. They work through the Vermont Family Network and others, One Home per House. Yeah. And families give a lot of volunteer time to help their kids with this. For futures. That's something. They're kind of there's not a loud voice speaking. That's why so the whole VCAP question, which I see fitting in the homeless situation, fitting into H91. I would like to set that aside and we can deal with that as we go through H91.
Yeah, that was my question. 23 and 24, are those amounts in H91 or are these separate from what's in H91? Or do we not know?
This is
Separate.
so H91.
Go ahead.
H91, addresses fiscal year 27, doesn't do anything for 26, except for the one-time $10 million to prep them for the UV HARP program. So there's nothing in there about 26 appropriations outside of wrapping up the 27 and giving them a budget for that.
Example. And I have to speak in favor of these.
Something there,
Yes.
I mean, you can add them. Well, no, it still have to be within the budget.
right? It has to be in the budget conversation.
Again, I would be remiss for my constituents if I didn't support for some of those in Burlington. It's dire.
Okay. Well, the thing about Burlington is everybody from all other parts of the state are starting to move to Burlington to get services, you know, so I'm, with all due regard, it could be the Northeast Kingdom folks coming down Burlington and accessing the services there. You know, but what H91 can do is to spread those services further, which would be great. I can't answer the question about the Champlain Valley OEO and their need for money to operational. I don't see how we can do that. As I said before, the Let's Grow Kids and the use of the funding there is something that I'm working with the pro tem on, so we'll take that down the hall. The Vermont Network, I think, has nothing here. They will get some funds through H91 theoretically. But I do think this is the only organization that supports people with domestic and sexual violence. Somehow putting them in as a safety net, organization is important. I'm not suggesting that we put specific funds in Nolan, but rather we're identifying organizations that should be.
What I would say,
Disagree with me.
even though they're getting money in 91, that's for a different purpose. So just be
Yeah.
mindful of that. This is
Yeah.
a separate ask outside of that
Exactly.
for a different purpose.
We don't do crime victim service. That's part of the, domestic violence section. It's all part, all the way up to 34, so that just. Oh, there's adult day services. Number 35. That is already in, on Cathedral Square, there's already money in the budget. Past that, look, I think we're supporting the work. Not necessarily the amount, but the work there. Number 38, the expansion of SASH to all regions of the state is really difficult.
There's two pieces there, right? There's
Yes.
400 for the Brattleboro and then 2
Right.
million for expansion. So it's 2.4
Yeah.
total. So
The
there are really two
Brattleboro-
requests in there.
Brattleboro is good because that's part of the pilot, which we just talked about earlier. But expanding it might be problematic. Would be great to do, but. Oh, what about Meals on Wheels? Safety net? We gotta do this all. This is all.
Same sense.
Safety net. To the extent,
To the extent we can.
You know, like,
and I'm sorry about the social workers.
I mean, with something like Meals on Wheels, they're asking for 2 million.
Yeah,
you could still give them less,
Right.
if you better than nothing, right? So I mean, just,
That helps.
but I'm just flagging like these numbers that are
Gotta get
here,
up to the home to
the
help.
numbers that are here, you could choose to give them a little bit less than what they're asking for. Because getting them something better than giving them nothing.
So we could choose, but they could also choose. We could tell them we
Correct.
want it and let them choose.
Yeah, I'm just flagging that there's different ways to
Right.
sort of.
Yeah.
Spread well, that's
Right.
help organizations.
Okay, okay, I'm gonna go past the voices, because we talked about that earlier on reach up, and it's part of the, could be part of the language. That's it. Oh, good. One more. NOFA. On the last page, number 40. Oh, the 2.8, oh, the Vermont Disabilities Council, that's in the BAA. And I think we really, I think, yeah, look, I think there's funding there for it already, and we have supported that when it's.
It is really.
No, there is a lot of money.
I was stuck with my notice.
And just so you know, it might be in the BAA, but there is no BAL.
I know, so would you like to highlight, do we want to highlight the Vermont Disabilities Council request for getting this one over the finish line? This is so important.
That's the housing.
Yeah. it
Yeah,
has to get done.
Yes.
Yeah. Okay, and then we have NOFA, which was in the house already, so we've already said we'd like the house, but the house is done, we don't know the amount.
300.
Yeah, I know.
Yeah.
The house is done up there. And then we have our bills. Okay, Nolan. Committee? I need to find a place to hide. That's really tough.
I'll meet you under the table.
I know. Go ahead, so.
I think we've all been pretty clear about our priorities, when it comes to NOFA on keeping the way it is, or if we can find another 100 that we can halfway so the 500 they want.
That'll be, I know that's gonna be a
Yeah.
talk about now,
Yeah.
also, but we do think it's important to go through them.
And we talked about doing a hybrid, like a hybrid, some line items, and then also
Yeah.
have just a general intent statement from the committee. I have written up what we can use, if you'd like me to read that.
Send it, read it. I think that's what.
I can read it and send it.
Let me hear what you have to say.
So I have 3 bullet points and 2 of them have just subset bullet points, but prioritize programs that are efficient and effective and can prove that the responsible stewards of state funds, programs and organizations that can prove a successful track record of Senator Cummings, and programs and organizations that allocate more funds towards helping Vermonters than administration of payroll is mine. We support programs that are vital, DAs and SSAs, primary care, recovery, basic needs, i.e. rental assistance and food. And then prioritize base funding ongoing operations over expansion/new programs.
Okay, the only other thing that I will add in there, like the overarching, is that we're looking to move upstream prevention and to ensure that we're saving money downstream. I mean, that's always been kind of we have it moving upstream right there. But I don't know that everything that you've said in there, we can't demonstrate here that we have all that information to support, but we would like, that would be the ideal, right?
Yeah, can I just say that also, I mean, I think I like your language, but we would have to define like what is efficient, what does that mean for us? And all
All that was kind of appropriations.
right, and also not, like we said earlier, not everything here, when you say proven, I mean, it means that we have data and we don't for everything.
Right, and to the extent practicable, we have data informed,
To the extent practical, okay.
boom, and
Did you-
then we don't have
that?
to go through.
That's
I
an
mean, I
important,
can put that in there, but
Yeah.
I personally think that's a little implied.
Okay.
Because obviously.
So I'm gonna
we
let
have-
Nolan pick up on this. You can send him what you want, but I'm
I
gonna,
think Senator Douglas
like
kind of captured, well, I mean, did my
Okay.
job for me, I
can you
think.
send it to me and us, but I'd like to edit it.
I just don't want to not fund programs that we may not have data on yet, because they may be great.
We're still in pilot.
we're
We're
not-
still doing.
Okay.
And we know that for some of the work that we do are national models, AIE SASH, AIE Blueprint. And we don't want to lose those. And we know that there are people who don't believe that the results are, demonstrate, advantages. So they do.
For what you just said, but prioritize prevention of illness before treatment downstream, is that kind of what you're trying to say?
Prevention is also social determinants of health that we're talking about, not just illness.
Also, I'd be remiss if I didn't end on the required doom and gloom conversation of we're operating within a framework of knowns, because that's all we can operate in. And in, the next month or so, we could get more information from the federal government where we suddenly have $200 or $300 million general fund hole and we're starting all over again. So I just have to say that out loud, to remind people that the house
I think
is
you're
on
right
fire.
on target, and I know that
When do we take it to the streets?
as we look at
Okay.
joint fiscal oversight and joint fiscal committee oversight, and as we look at other emergency board oversight and how that will be dealt with, we should acknowledge that in our.
When I say the house is on fire, I mean like,
I know.
like healthcare, education system, like, and we have all these needs and
Yeah.
our fire hose might be getting a little more restricted going forward to address all the basic needs, safety nets, et cetera, et cetera. So we're operating within this constraint. I just have to say that the bubble may change. I just have to say it out loud.
The bubble will burst.
Well,
That's the thing. I think, yeah. Thank you, Nolan. So whatever if we could see a memo, I'd like to look at it, and then if anyone look at it, and then we'll try and get it, we'll mail it down the hall. In my hand.
Send it via page.
Every page.
The thing we might want to consider, my source tells me that what we're probably going to see is able-bodied adults off the road.
Yes.
Which is what we Medicaid,
Yeah,
which is what we did Catamount Health for,
yes.
because these were frequently working people, but they didn't have children. But they couldn't afford health insurance, and so we're gonna, at $44,000 a year.
Nobody can afford that.
No,
Our small businesses are going to leave, or we will lose, businesses, our economy will not be happy.
but we do need to get cost of health insurance down. But we should be doing some thinking about what are we going to do if we suddenly have hundreds or thousands of able-bodied working people.
Yes.
But I'm not making enough to afford private insurance. Because there's been some pretty horrible stories from other states that did not ever do the expanded Medicaid.
So we'll end on that happy note. Thank you, Senator. And Nolan's happy note, and our little black cloud of authoritarianism. But the happy note is, I think we understand, in this room, I look at some people who work very hard to ensure that the safety net is there, that primary care folks are there, and that we have support services upstream for kids. And that there's food on the table. We appreciate the work of all our organizations. We're all in the same boat right now. Some of you more than others. We'll do what we can do, and it's now never over till it's over.
Brandon,
Just saying, CC,
huh?
I CC everybody, all its work. The work you guys have to do.
You're hired.
Yeah, thanks.
I don't know
Also,
what work you CC.
Prove and to demonstrate.
Well, I'm gonna edit. Anyway, we'll look at it and we are gonna move on. So, good. We're
I.
No. It gets some air.
Let's take 5 minutes at 10 hours to start with, we have people waiting on Zoom for, I don't want to leave them